Hi, I'm Shuai.
Right.
I'm your GP for today. So I've been asked to do a examination of the varicose veins that you have. So it's gonna have me having a look, having a feel, and then having you following some instructions. Is that okay?
Sure.
Okay, thank you. I'll just go wash my hands. Okay, can you just stand with your feet apart? I'm just gonna be having a look, okay? So on inspection of a patient's varicose vein, it seems like that is a long cephalous vein extending distally to the posterior aspects of my patient's left tibial, and also to the proximal end is to the posterior aspects of just behind the popliteal fossa. The site of it and the extension as well. So on further examination, there's no scarring, no obvious redness, rash. The hair distribution seems to be normal, and there's no obvious thickening of the skin as well. And there's no obvious pigmentation. Okay? So I'm just gonna have a feel of your legs. Is there any tenderness there? So patient does not complain of any tenderness, which is a sign of strongylophlebitis, and the temperature seems to be normal, and there is no obvious ulcers and no obvious that it's just smooth. Okay. So is it okay if you just lie on an examination table with your head facing up? You can just lie on the edge.
Yep.
Are you comfortable there?
Yep.
Okay. So I'm just going to feel for the pulses. So popliteal pulse spout. And also the dorsal dorsicalis and the tibial posterior tibial. Okay, so that's all normal. So I'm going to do a special test. It's called the Trendelenburg test. Okay. So first, I will look at the varicose vein and milk the varicose vein, and then I'm going to find the fibular cephalous junction, which is once I find the tubercle of the pubis, and it's 4 centimeters lateral and 4 centimeters inferior. So this will be the junction. Can you just cough on me, please? Okay. And I'll be putting a tourniquet here. And then afterwards, I'll tell my patient to stand up. Can you just stand up for me, please? Okay. And I'll release the tourniquet and I'll observe for the refilling of the varicose vein. So, okay, that's good. And then afterwards, I'll be doing a Perthes test. Is it alright if you just lie down a bit more? Okay. So right now, I'm going to release the tourniquet and let the varicose vein refill. And then afterwards, I'm going to put the tourniquet back and ask my patient to get up. Is it alright if you get up with me? And observe for the varicose vein refill. Okay, thank you very much for that. You can get dressed now. Thank you.
Thanks.
Perthes test and modified Perthes test. Perthes test is to assess if there is a history of DVT. How to do this is when get the patient to stand up and do exercise and ask the patient if they experience pain in the calves. If the patient complains of pain, that means there is DVT.
The modified Perthes test is to test for the competency of the perforations. If the perforated valves are narrowed, that means they are unable to drain blood from the superior to the deep veins. How to do this test is, once the varicose vein is filled up, put a tourniquet in the SF junction. Afterwards, tell the patient to stand up and do exercise. If the varicose vein goes away, that means that the perforator is competent. If the varicose vein remains, that means that the perforator is incompetent.